In 2021, roughly 9,000 overdoses in our state were reversed by the medication naloxone. First responders say knowing how to spot and treat an overdose can make a huge impact on the outcome of a patient. And they're training the public to do just that. News Center Maine's Carly Dion has more.
More than a dozen people gathered at the Southwest Harbor Public Library Saturday morning to learn something new.
They're attending this because they want to be able to help somebody and they want to be more knowledgeable in it.
Bar Harbor Fire Department Deputy Chief John Lennon is training the public on how to administer naloxone. Also known as Narcan, it's a medication that can quickly reverse opioid overdose.
I didn't know it was a nasal spray. I didn't know it was so easy to use.
Lennon began his presentation discussing some of the warning signs in someone who may have overdosed, including unresponsiveness or unconsciousness, difficulty breathing, snoring or gurgling sounds, and discolored lips or fingernails.
I learned a couple of the telltale signs that I didn't know, particularly the pinpoint pupils is something that I hadn't been aware of.
Lennon says step one in any emergency is always to call 911. Then, if you have naloxone on hand,
you can go ahead and give that Narcan and initiate that early on treatment.
Narcan nasal spray comes in a box like this, and it comes with instructions inside if you're unsure of what to do, but it's as simple as taking out this device, putting it up to one of their nostrils, and administering the spray.
Monitor the patient afterwards, put them in a recovery position, and wait for public safety to arrive.
The recovery position includes placing the person on their side, using their arms to prop up their head, and one knee bent for balance. Lennon says even if you only suspect someone has overdosed based on the signs, but aren't 100% sure, it's still best to give the treatment.
It does not adversely affect another medical condition that may be present.
Leo Cook runs Sawyer's Market, just a few doors down from the library. Cook says being prepared for an emergency like this is important as a business owner or even just as a neighbor, knowing every minute counts, waiting for first responders to arrive.
There's a big difference between 1 minute without oxygen in your brain and 5 and 6 and 7.
It betters their chances of a positive outcome.
Each person in attendance receiving a naloxone box to take home with new knowledge that could potentially save a life. In Southwest Harbor, Carly Dion, News Center, Maine.